You all convened faster than I thought you were going to. Now I'm embarrassed. I got to wait about 30 more seconds. I'll tell you a story while we're waiting. One of our graduates is the Honorable Dechen Wangmo, who is the Minister of Health now of the country of Bhutan. And she was elected to be president of the 74th World Health Assembly, which is the annual policy meeting of the WHO. So she will be in charge of that meeting upcoming. So I thought that was a fun little side story. We do like to produce leaders like yourselves. We'll start now. Welcome. On behalf of the faculty and staff of the Yale School of Public Health, I congratulate the members of the unique class of 2021. We are gathering with limited attendance to ensure group safety, celebrating your achievements and acknowledging this graduation milestone. My colleagues and I welcome, thank, and congratulate all who played a critical role in shaping the aspirations of all of you, our YS.Ph graduates, and contributing to your success. These special people extend well beyond Yale, of course, most notably your parents or guardians, your role models, your siblings, your grandparents, your extended family and friends, and for some of you, your spouses or partners and your children. Here at the school, we are grateful for all the ways in which you all, beyond this tent, have helped today's graduates develop into public health professionals. Thank you all who have made possible the academic and life journeys of our graduates. Please accept our heartfelt gratitude as we recognize your contributions to our graduates. To all of you, this is my brief oration, and there will be no quiz at the end. The past 18 months have thrust the relevance of public health into the public spotlight. As we battle a historic pandemic threat, we are highlighting the social inequities that drive poor health for vulnerable segments of our population. This might include the institutionalized elderly, blue-collar workers on the front line of service to society, persons charged with care for the sick, persons with disabilities, those with social isolation, anyone with housing, food, or employment insecurity. Risk of death is tracked with these variables, confirming racial, ethnic, and economic disparities in both risk and access to early testing and care. Our environmental scientists have been working to keep air quality safe in buildings. Our epidemiologists, biostatisticians, and modelers have worked to unearth the causes and solutions of the pandemic and to forecast its course. Our social and behavioral scientists have worked on health communications and messaging for risk reduction and improving vaccine confidence. Our molecular and microbiologists have helped discover new diagnostics, new therapeutics and vaccines, unearthing origins of disease pathogenesis. Many entities in our school have engaged the community with an intensity that has transformed our relevance to our own university alongside myriad local, state, national, and global entities. I'd like to mention 3 school groups that have provided immense public service: our Office of Public Health Practice, our Emerging Infections Program, and our Community Alliance for Research and Engagement, CARE, partnering with Southern Connecticut State University, alongside scores of you who are student volunteers in community service. Public health can no longer be invisible to society as it is now highlighted on the pages of our newspapers, blogs, and social media in ways not seen since the beginning of the HIV/AIDS pandemic in 1981. YS.Ph can be proud of its socially responsible role in helping protect the health of our communities and to mitigate the spread of this devastating virus. We have worked with nursing homes, school districts, arts organizations, partners in low and middle income countries on 3 continents, and many more. We've engaged the Office of the Mayor and the New Haven Department of Health, the Office of the Governor, and 5 Connecticut state departments, namely Public Health, Education, Correction, Social Services, and Energy and Environmental Protection. We've guided institutions in nearby states, such as New York and Rhode Island, as well as far afield, such as Connecticut and California. With our own colleagues in multiple schools and programs at Yale, we've been at the forefront of COVID testing, forecasting, clinical epidemiology, vaccine policy, and mitigating health and economic harms in this time of tragic loss and economic crisis. Most importantly, we're doing this work together at the forefront of Yale's response to the pandemic. On February 28th, Yale's Provost Scott Strobel sent me these words, I quote, "The YSPH has made a tremendous contribution to the Yale community during this pandemic. Your school has boosted our overall mission to support the health and well-being of the Yale and New Haven populations. YSPH faculty have also made invaluable contributions to combating COVID-19 on a national and international scale. We are grateful to the school for all of these efforts," end quote. You, our graduating students, have studied in YSPH at a historic moment for our nation and our world, during a defining public health crisis of our era. You have studied to prepare to tackle the challenges most needed for the world to heal, learn, and move forward. I'm immensely proud of the student role in how our student faculty pivoted to respond to the urgent needs of the pandemic. Our community embodies strength, perseverance, and courage. Each of you has shown your commitment to public health and your own resilience during this most difficult time. We in public health represent the vital workforce that is mitigating viral spread and illness. You are uniquely equipped to enter this public health workforce. You have a skill set that the world desperately needs right now. There are countless opportunities for you to alter the future for the better in your chosen disciplines. While we regret that your experience at Yale was compromised by distance and restrictions, we all hope that you leave with pride, knowing that your studies in public health happened at a truly historic time of challenge for our nation and our globe. Public health seeks to further wellness and prevent disease. It's gratifying to work in a field that seeks to reduce death and suffering, to promote joy and well-being, and to keep our planet safe and healthy today and for centuries to come. There are few vocations that have more potential than public health for contributing to the collective welfare and enriching the lives of so many with effective interventions. As public health professionals, we can wake up to our work days and be fully confident in their inherent worth to humanity. When people ask me about the best part of my job, I can say that it's the inspiration I get from the passion our students bring to YSPH. Engaging you, our future public health leaders, learning about your accomplishments, plans, and aspirations gives me a tremendous sense of optimism for the future of our field. The faculty have been honored to work with you, teach you, and learn from you. Changing gears, I would now like to thank Joanna Chen for serving as this year's Student Marshal. Where's Joanna? There you are, Joanna, thank you. Joanna is a biostatistics M.P.H. candidate. She's also a research intern at Mila, Quebec Artificial Intelligence Institute and the Veteran Affairs Hospital. Her research work includes accelerating the process of drug discovery, using artificial intelligence, and investigating neurotoxin treatment for veteran patients with migraines. The acronym for the Student Association of Yale School of Public Health is SAYPH, or SAFE. Joanna served as the Alumni Engagement Chair at SAFE, a co-executive director at HealthCore Yale, which is focused on health in Latin America, and she's helped as a biostatistician at the Haven Free Clinic. She hopes to be a machine learning engineer or data scientist in the future, using technology to contribute to the healthcare field, serving large populations and society. Thank you for serving as this year's Student Marshal, Joanna. And to be strategic, I think we'll clap at the end of my comments each time. Good. It's now my pleasure to thank Allison Bailey for serving as our banner bearer. Allison, where are you? There you are. Allison is graduating with an M.P.H. in epidemiology of microbial diseases. Before starting her M.P.H., she attended the University of South Carolina, earning a public health bachelor's degree. She's worked in the Yale Institute for Global Health and also the Connecticut Emerging Infections Program, where she did her summer internship. Allison served as the president of the SAFE board and as a teaching fellow for the first-year course, Introduction to Public Health Ethics. Outside of YSPH, she volunteered at the Haven Free Clinic as an education volunteer, as a contact tracer for the City of New Haven and Yale University. And we want to thank you for serving as this year's banner bearer, Allison. This year's faculty marshal is Professor Ted Cohen. Ted? There he is. He doesn't want to stand up, that's fine. Ted is an infectious disease epidemiologist whose primary research focus is tuberculosis. He is particularly interested in understanding how TB drug resistance and medical comorbidities, such as HIV, frustrate current efforts to control TB transmission. Ted's team has its ultimate goal of developing more effective approaches to limit the morbidity caused by this global scourge. Ted's training is in epidemiology and clinical medicine, and his research work deploys mathematical modeling, fieldwork, and analysis of programmatic data, and is funded by the National Institutes of Health, the NIH, the CDC, the U.S. Agency for International Development, and the Gates Foundation. Thank you for serving as this year's faculty marshal, Ted, and just stand up so we can properly acknowledge you. It now gives me great pleasure to introduce Misakir Adnu, chosen by her peers, all of you, to develop this year's student address. Before coming to YSPH, Misakir earned 2 undergraduate degrees, one in health sciences and another in community health from Whitworth University. She worked with non-governmental and governmental organizations focused on child health and wellness. During her time here at YSPH, Misakir has served as a healthcare management student ambassador, a graduate teaching fellow, logistics chair for the Global Alliance for Public Health, co-founder and president for Yale Connecticut Hospice's advisory board, and graduate assistants for one of the wellness, engagement, and leadership development subcommittees of Yale New Haven Hospital. Misakir also served as a research assistant at the Yale Institute for Global Health, supporting systematic reviews of international breastfeeding practices and helping coordinate the Institute's 2nd annual Global Health Case Competition. After graduation, Misakir joins the International Health Unit of Samaritan's Purse, supporting global medical missions, notably in global maternal infant health and humanitarian emergency response. It is my honor and delight to invite to the podium our 2021 student speaker, Misakir Adnu. I'm supposed to put this on. Sorry about that.
Well, good afternoon, and thank you, Dean Vermond. These last 2 years have reminded me over and over that when public health works, it doesn't get in the news. Only when something catastrophic happens is when you see those that have been tirelessly working in the background come to the forefront to offer wisdom, guidance, and possibly hope. Coming to the Yale School of Public Health, I felt like an intruder in a space that was not mine. Not just because I was an international student, but because I thought that my accolades or work experience did not measure up. I thought that somehow someone here would find me out someday. That imposter syndrome hit deep. Indeed, I was challenged, but in a good way. I jumped on board the various great opportunities Yale had to offer and learned a lot from my peers. The internship search frenzy that started on day one, though, was a particularly bizarre experience. Fast forward to today. Who would have thought 1 or 2 years ago that this would be us right now? That we would be a cohort that experienced a history-making series of events. As the world grappled with how to move forward from an apocalyptic pandemic, we did our best to provide commentary and optimism. But of course, no one is ever really prepared to handle a worldwide catastrophe. Side note though, we could have done better. As issues of racism, sexism, and xenophobia rock the US and the whole world, we knew that the world would never be the same again, or at least we hope it wouldn't. These issues, of course, were there all along, but somehow we needed a world-stopping event to shine a spotlight on them. And I hope that these issues have rocked us enough that we will go into our professional spheres and become or continue to be voices of change. Regardless of how this world shapes up in the next few years, being affected by a pandemic is a history we share. But where we go from here, shaped by its revelations, is up to us. As CEO Winslow put it, quote, "You and I have determined that men should not sicken and die from polluted water, from malaria-breeding swamps, from epidemics of diphtheria, from tuberculosis," end quote. That is a good reminder for why we do what we do. We join this fight of social justice because our work is predicated on the conviction that all human lives are valuable and worth fighting for, not only the ones with the loudest voices or the most resources. Perhaps our plans got changed since we got here, and we are now pursuing a totally different path influenced by that one professor that made us see the world differently, or that one interaction with someone different from us. But one thing is for sure, we have made friendships here and networked to the maximum extent possible. Let's be mindful of those connections as we head out. Our interest in the field of public health reminds us that we have all come here to get tools we can use to impact the world. And some of those tools are the connections that we have formed here. After the many "I hope you're doing wells" we have typed begrudgingly or tried to find alternatives for, after hearing "you're on mute" for the 100th time and after wading through 10,000 plus listserv emails, we are here. After news stories that made us go, "What the," fill in the blank, we feel the pressure of performing well in a critical job that is in a field underfunded for its mandate. But we are in too deep. We are in too deep to shy away because of the imposter syndrome we might have felt when we started. We now have a mandate to communities' health and well-being, to the betterment of society. But that betterment is time, geography, culture, and religion specific. To indeed do our work best, we have, from our classes, interactions with peers, and our community engagement, found that we have to listen first. We have to listen to communities and then respond with, what does your community think is the right thing to do, and how can we help you get there? And if we are ever to feel imposter syndrome, that is the right place to feel it. The feeling of being an imposter in a new community is warranted and acknowledges that we have a lot to learn from community wisdom. Those are settings where we do need to feel like imposters. In those instances, we listen, we share our expertise, and we build with communities together. I hope that the hefty dose of cynicism we have acquired doesn't consume us, but rather keeps us realists regarding what can be done in our lifetime and what foundations we can put in place for the next cohort of driven public health professionals to keep humanity moving forward. So let us keep determined that we will find ways to bring concepts of quote-unquote value-based care or sentiments like learning from the global south into reality. Let the learnings from the intensive research we did for that one case competition drive us as we problem solve in another context. As we exit our bubble, let's become integrated into and known by communities, instead of only being people that community hears about when disaster strikes. As we exit our bubble, let's become integrated into those communities that we then become a part of and move humanity forward. What we have done here is phenomenal research, and we have volunteered with many communities in need. Let's make that a regular practice. There is precious work to be done, and we have been dubbed qualified to do it. Lux et Veritas is indeed the school motto, and our world needs some light and truth right now. Our world needs us right now. As the old Yale song goes, oh, let us strive that ever we may let these words our watch cry be, where upon life's sea we sail, for God, for country, and for Yale. And a special thank you to the villages that raised us and the family and friends that have supported us this far. In my native language, Nkwanda Sialachu, Nkwanda Sialan. Congratulations, class of 2021. Thank you for a fabulous 2 years.
Thank you, Ms. Zakir. Those were insightful and inspiring words. Thank you very, very much. It is now my privilege to introduce our distinguished 2021 commencement speaker, Dr. Anthony Fauci. It was my good fortune to have worked for Dr. Fauci at the NIH, actually before most of you were born, from 1988 to 1994. And we've stayed in touch ever since. Dr. Fauci is Brooklyn-raised, going to college at Holy Cross in Worcester, Mass., and a medical school at Weill Cornell Medical College, where he also trained in internal medicine. He did his immunology and infectious disease training at the NIH, where he has spent his entire career. Since being appointed director of the National Institute of Allergy and Infectious Diseases in 1984, I think he was 44 years old at the time, Tony has become the longest-serving NIH Institute director ever. He has advised 7 presidents, from our 40th president in the 1980s to our 46th president today. His list of awards include receipt of our own Winslow Medal, the highest award given by the YSPH in our centennial year of 2015. Dr. Fauci is a member of the National Academy of Sciences and the National Academy of Medicine, and he has received scores of honors. Anyone who's been in his office at the NIH sees them by the dozens on his walls, and that's a tiny fraction. These include the Presidential Medal of Freedom, the National Medal of Science, the Kober Medal of the Association of American Physicians, the Lasker Award for Public Service, the Robert Koch Gold Medal from Germany, the Prince Mayadon Award from Thailand, and Canada's Gardner Global Health Award, a tiny fraction. Dr. Fauci has made fundamental contributions in understanding and mitigating formerly fatal inflammatory and immune-mediated diseases, HIV destruction of the body's immune defenses, and national COVID responses. Among authors in the field of research and experimental medicine, citations of Dr. Fauci's work rank him 20th among 2.4 million scientists. Due to COVID-19 constraints and scheduling complexities, Dr. Fauci joins us via cyberspace to give his 2021 commencement address to the YSPH M.P.H class of 2021. Graduates, faculty, staff, friends, and families, it is my pleasure to introduce my friend and mentor, Dr. Anthony Fauci.
Members of the faculty, distinguished guests, family members, and friends of the graduates, and you, the 2021 graduating class of the Yale School of Public Health. It is a personal pleasure and a privilege to speak at your commencement, and it is truly an honor to speak to the graduates of one of our oldest and most distinguished schools of public health in the world. It is also especially meaningful to me as so many members of your faculty have been close colleagues, collaborators, and friends for many years. This is an extraordinary time to enter the field of public health. The challenges posed by the COVID-19 pandemic at home and abroad have brought into sharp focus the world's need for the science and art of public health professionals and the imperative of robust support of our public health enterprise. The COVID-19 pandemic has upended our entire planet, challenging past assumptions about our preparedness for a global pandemic. COVID-19 has at least 4 characteristics that have allowed an historic assault on humanity. First, it is caused by a virus that, to our knowledge, never had infected people in a sustained manner. Second, the virus has extraordinary transmissibility from person to person. Third, it has a high level of morbidity and mortality, especially among seniors and those with underlying comorbidities. And fourth, like so many other diseases, such as HIV, TB, diabetes, kidney disease, and others, COVID-19 has exacted a disproportionate toll in minority communities, especially African Americans, Hispanics, and Native Americans. It indeed is the perfect storm of an emerging infectious disease, or, as I have worried about for years, my worst nightmare. And so, the expertise, energy, passion, and commitment that you soon will bring to the world amid COVID-19 come at a most opportune time. Rarely before has the world so badly needed the skills inherent in the many disciplines represented by this class: epidemiology, biostatistics, public policy, community health, health economics, and many others. Public health in 2021 is truly, to use the parlance of business and economics, a growth industry. I must tell you, the immediate and urgent need for the talents and training that you possess were less apparent when I was embarking on my own career in medicine. In 1968, I completed my residency in internal medicine in New York City. Around that time, various health experts and pundits had opined, believe it or not, that the threat of infectious diseases was nearing an end. This view was rather widely held. Great advances with medical interventions, such as antimicrobials and vaccines, had engendered great optimism. And some went so far as to suggest that it was time to close the book on infectious diseases and shift public health resources to chronic diseases, thus adding new meaning in my mind to the word provincialism, since malaria, TB, vector-borne diseases, and so-called neglected tropical diseases continued to rage in low and middle income countries. Against this backdrop, in 1968, I was on my way to begin, of all things, an infectious diseases fellowship at the National Institutes of Health. And so as I drove south on the New Jersey Turnpike from New York City to my new job, the words of the pundits, many of them renowned experts, rang in my ears. I had a sinking feeling that I might be obsolete even before my career had begun. A bit like training to be a VCR repairman. Unfortunately, the pundits were dead wrong. They declared victory prematurely. And for the football fans among you, this was sort of like spiking the football on the 5-yard line on an open field run. For at about this time, scattered cases of a strange wasting disease were being noticed by missionaries and healthcare workers in sub-Saharan Africa, off the radar screen of the Western world. The sparks of the HIV pandemic had already become a low flame, and soon a growing fire that would transform the world, and for me, my professional career, if not my entire life. Of course, in the 40 years following the recognition of the AIDS pandemic, we have seen dozens of disease emergences. The past 12 years alone have brought H1N1 swine flu in 2009, chikungunya in 2014, Zika in 2015, and multiple outbreaks of Ebola in Africa from 2014 to the present, just to name a few. Now, obviously, not every opportunity or challenge that you encounter will influence your careers and your lives or be as dramatic as a frightening infectious diseases outbreak. However, please believe me when I tell you that something akin to the unpredictable events that I have experienced in my life and in the evolution of my career are going to confront you, regardless of what directions your careers and your lives take. And so, expect the unexpected and seize the opportunities to make a difference when the unexpected arrives. Over my career, I have learned that when a new health challenge emerges, it is critical to not downplay its severity and never underestimate its potential to become an endemic or pandemic. We have been through this over and over, and usually we only see just the tip of the iceberg, or, to use another metaphor, the eyes of the hippopotamus, while the vast burden or potential burden of diseases lies beneath the surface. And so consider HIV and AIDS. 40 years ago next month, in June 1981, we learned of 5 gay men with a strange new disease without a name or an etiologic agent. Then 1 month later, an additional 26 young gay men, then injection drug users, heterosexuals, infants, and thousands of others in the Western world, before we even began to appreciate the huge and growing burden in sub-Saharan Africa. Still, some suggested that the problem would go away or stay confined to mostly marginalized people. But as we would painfully learn, the body of the hippopotamus lurked beneath the surface. Fast forward 4 decades, we now have 78 million people with HIV, and more than 32 million have died. With COVID-19, I am sure many of your mentors have felt a certain deja vu, with promises that the pandemic would disappear like magic, even while the pandemic surged with tens of thousands of cases and thousands of deaths each day. At a time when we should have been focused like a laser on the historic challenge facing us, when decisions and public health messaging should have been driven by data, we too often heard happy talk. As has happened too often before, victory was declared too soon. We must not let that happen ever again. When a new public health crisis arises, if it feels like you are asking too many questions, issuing too many warnings, and communicating too much, then you probably have it just about right. With COVID-19, as with HIV and previous outbreaks of unrecognized pathogens, the scientific community had a steep learning curve. We have learned collectively to be open-minded and humble enough to change our recommendations or our guidelines, our policies, depending on the evolving data. If a situation is static and does not change, then stick with the data at hand. If the situation is evolving before your eyes, stick to the science and go with the data as it evolves. If you look at what we knew 15 months ago compared to what we know now, our understanding of COVID-19 has grown almost exponentially. The role and utility of masks in blocking transmission, the spread of SARS-CoV-2 by asymptomatic and pre-symptomatic people, the importance of aerosol transmission, especially in indoor closed spaces, all of these evolved dramatically and rapidly, as did our understanding of the pathogenesis of the disease and how to treat it. We must always let data drive our decisions. In the current pandemic, our response has sometimes been distracted and precious time and resources wasted by the inclination to just try something, anything, a Hail Mary pass, if you will, based on anecdotes or a hunch that something might work. Unproven drugs were touted on the internet and social media by politicians and even some medical personnel who sometimes made the incorrect assumption that the benefit of these approaches would outweigh any harms. Randomized controlled trials of many off-label therapeutics often eventually proved a lack of efficacy and in some cases revealed severe adverse events or worsened COVID-19 outcomes. One notable example was hydroxychloroquine. Ultimately, numerous randomized controlled clinical trials showed a lack of efficacy for hydroxychloroquine and a concern for safety. Meanwhile, rigorous trials have proven the utility of several therapies in both outpatient and hospitalized patients. That is, we now have interventions that actually help patients. I would like to leave you with one final thought. Our country's experience with COVID-19 has put a spotlight on one of the great failings in our society, the lack of health equity. COVID-19 has exposed long-standing inequities that have undermined the physical, social, economic, and emotional health of racial and ethnic minorities. With COVID-19, many members of minority groups have had a much greater risk of COVID-19, often because of the nature of the jobs that many of them have as essential workers in society. More importantly, when people in minority groups are infected with the coronavirus, they have a much greater likelihood of developing a severe consequence due to elevated rates of underlying conditions such as hypertension, diabetes, obesity, chronic lung disease, among others, that lead to a multifold increased risk in hospitalization and death. Very few of these diseases are racially determined, and almost all relate to the social determinants of health dating back to conditions that many folks find themselves in from birth, such as limited availability of adequate diet, lack of access to health care, and the restrictions and pressures put upon them by the undeniable racism that exists in our society. Let us promise ourselves that our corporate memory of the tragic reality of COVID-19, an infectious disease that insidiously and disparately hospitalizes and kills people of color, does not fade after we return to our new normal. It will take a decades-long commitment for society to address the disparities that once again emerged during this pandemic. I strongly urge you to be part of that commitment. We must together find the strength, wisdom, empathy, and kindness to address these entrenched elements of injustice, manifested in so many ways, subtle and overt, and work with all our might to remedy the cultural disease of racism, just as we fight the viral disease of COVID-19. Along the way, we always must use data-driven approaches to foster meaningful engagement with community institutions and diverse leaders, and to conduct culturally responsive outreach and research to address health disparities. If ever there was going to be a real incentive for us to make a commitment to address these social determinants of health, it has got to be now. Thank you again for the great honor of speaking to you today. Congratulations to you, to your families, and to your loved ones. Good luck, and God bless you.
We certainly want to thank Tony very sincerely for wise counsel, inspiration, and his leadership and service to our nation. But now it's your turn. Now we would like to acknowledge you, our student awardees for this year's commencement. We're going to ask that the student awardees remain at their seats as we review these awards and honors, but we do want you to rise when your name is called to be acknowledged for your achievement. The faculty and I want to commend all of you for the excellence of your theses and your capstone projects. There's some remarkable work in this pool of achievement. And it's my great pleasure to announce recipients of two of our prizes, the Dean's Prize for the Outstanding M.P.H. Thesis and the Wilbur G. Downs Outstanding Thesis Prize in International Health. The Dean's Thesis Award Committee has selected Krzysztof Fawa as the Dean's Thesis Prize recipient for his thesis titled Overseen and Overlooked, Knowledge Production and Care in Public Health Surveillance. Where are you, Krzysztof? There he is, way in the back, way in the back. This work analyzed contact tracing as a case study of public health surveillance as a cultural and social phenomenon. Examining federal guidelines and statewide patient and contact interview scripts, contact tracing was seen to have dual functions for both knowledge production and public assistance. In COVID-19, public health's commitment to knowledge production was emphasized substantially over public assistance. And this creative thesis from Krzysztof concluded by addressing how future public health practice can better support the public assistance elements of contact tracing. Jason Schwartz and Lisa Messeri served as Krzysztof's thesis readers. So one more time, excellent work and congratulations, Krzysztof, for this Dean's Prize. The Wilbur G. Downs Outstanding Thesis Prize in International Health is named in recognition of the late Professor Downs, a pioneer in international health and a long-term faculty member at YSPH. I was very privileged to know Professor Downs, a remarkable scientist and human being. It is awarded to a graduating M.P.H. student with an outstanding thesis in the field of international health. The faculty have selected Matthew Stephen Benkowski for his thesis entitled Assessing Changes in the Epidemiology of Cutaneous Leishmaniasis in Southwest Colombia following the peace accord with Fuerzas Armadas Revolucionarias de Colombia, FARC. Where are you, Matthew? There, right in front of me. Good. Matthew sought to unravel the impact of civil strife on tropical disease control and prevention in the context of the 50-year Colombian conflict culminating in November 2016 with a peace agreement. Cutaneous leishmaniasis is a vector-borne parasitic disease of the skin that can cause scarring and destruction, along with stigma related to disfigurement. In examining changes in demographic and clinical characteristics of almost 1,400 patients with leishmaniasis before and after the signing of the peace accord, far better leishmania outcomes were noted in the post-signing era, thanks perhaps to freer travel and faster access to medical care. Christian Chudi and Mayur Desai served as Matthew's thesis readers. Matthew, again, great work and congratulations on this Downs Prize. The Henry J. Chauncey Jr. Inspiration Award was established in recognition of retired faculty member Sam Chauncey, who developed our program in health management and fostered its close collaboration with the Yale School of Management. A former secretary of the entire university and distinguished member of the Yale and New Haven communities for many decades, Sam has been both an agent of change and an enduring friend of YSPH. This award was first sponsored by the Health Management Program class of 1999. It is now supported by the Dean's Fund for Education. It is given to the graduating health management student who most exemplifies innovation, integrity, leadership, and community service. This year's recipient of the Chauncey Award is Ms. Secure Adnu. I've already introduced Ms. Secure, who is being recognized for her impressive scholarly achievements alongside her leadership within the university community and beyond. As mentioned earlier, she has served as a dedicated teaching fellow for our students, has co-led several global health initiatives on campus, and has contributed to the Connecticut Hospice in ways that will live on long after she graduates. We've seen her lead with warmth and compassion, impressively during the early days of the COVID-19 pandemic. Ms. Secure and her YSPH peers worked closely with local faith organizations in their response to the pandemic, creating newsletters and online public health-focused resources for these communities. Congratulations, Ms. Secure, on this Chauncey Award. The Lowell Levin Award for Excellence in Global Health is awarded to a graduating student whose work addresses health promotion and global health. The recipient is selected based on their internship experience and overall academic record, as well as academic leadership and community engagement. Professor Levin, a YSPH alumnus, was a dear friend to many and served as the first head of the YSPH International Health Division. I'm very pleased to announce that the Lowell Levin Award for Excellence in Global Health has been awarded to Haley Case. Looking for you, Haley. There she is, behind the camera. Haley is passionate about working in global health to promote maternal and child health equity through evidence-based programs. She came to YSPH with global health practice experience within maternal child public health programs in the United States, Chile, and Cambodia. At YSPH, her recent projects have included supporting qualitative research in Ethiopia, conducting quantitative thesis research on maternal health and child development among low-income families in Brazil, and co-leading an innovative systematic review to learn how early child development programs work in low and middle-income countries. Haley approaches global health through the lenses of intersectionality and social justice, with a goal of mitigating existing health problems and shifting the landscape to reduce health inequities. She is passionate about using evaluation data to inform global health action in planning and improving multi-component and multi-level interventions. Congratulations again, Haley, on receiving the Levin Award for your work. Our annual YSPH Student Award for Outstanding Contributions in Diversity, Equity, and Inclusion, DEI for short, recognizes one or more graduating M.P.H students who've demonstrated a significant contribution toward creating and fostering a diverse and inclusive community while at YSPH. You may see our new magazine, Focus, special issue, on diversity, equity, inclusion, and belonging, and it's online, and you can all read it at your leisure. I'm pleased to announce Lakai Leg, Yad El Harake, and Crystal Ruiz as the recipients of the 2021 Student Award for Outstanding DEI Contributions. All three students served as YSPH Student Diversity Ambassadors and were selected for their volunteerism, their involvement in research focused on vulnerable individuals or communities, and for their incredible efforts to build community and create inclusive environments for students, which was all the more challenging, yet critically important with many students studying remotely, distanced from their classmates. Lakai, Jad, and Crystal, thank you for your efforts in advancing diversity, equity, inclusion, and belonging at YSPH. And congratulations. Where are you? Three of you. 1, 2, 3. Okay. We would now like to acknowledge our teaching awards for this year's commencement. Teaching award recipients may remain seated as we review these awards and honors. Then we will ask all four of you to stand. The YSPH Teaching Fellow Award recognizes an advanced student who demonstrates outstanding performance as a teaching fellow, or TF, and promise as a future teacher. The recipient of the 2021 Teaching Fellow Award is William Eager, a second-year M.P.H. student in epidemiology of microbial diseases. His nominator said, "Will is absolutely exemplary of what it means to be an outstanding teacher and peer mentor in a top-flight public health graduate program, and he played a critical role in our course this year. Will is absolutely a shining light in our class and an example of what students can become when they dedicate themselves." A further testimonial stated, "Will is a really dedicated TF who tries to help each student succeed in class and gain a good understanding of the material. Aside from holding lab in person, which is truly helpful, Will is never short of an applied example to show why we are learning a certain thing. He checks in with his students regularly, incorporates discussions to develop and test students' understanding of the material, is very approachable, and a great help in navigating YSPH and all our classes in general. Moreover, I really appreciate Will's interest in being the best TF possible. He tests out ways of explaining concepts in class to figure out with the students which way is best for them." Where are you, Will? There he is. Congratulations on receipt of our Teaching Fellow Award. Now we turn for some recognition of our faculty. Would the faculty, just for a moment, all stand up to be recognized? All of you faculty over here, everybody stand up just for a moment. It won't take long, and you need to stretch your legs anyway at our age. Excellent. Thank you very much. We want to acknowledge our faculty. Now, this was a limited number of faculty by design, I'm afraid, because of the circumstances. Now, the YSPH Distinguished Student Mentoring Award recognizes a faculty member as a leader in shaping the next generation of public health professionals, and one who serves as a role model and conveys passion for public health, has clear and high expectations, encouraging students to achieve their full potential, and is sensitive to student needs and concerns and makes extraordinary efforts to help their students. Candidates for this award are nominated by graduating students and are selected by a committee composed of students and faculty. This year, the committee is giving 2 awards. The 2021 recipients of the Distinguished Student Mentor Award are both behind me in an alphabetical queue, both assistant professors, Dr. Jacob Wallace and Michael Wininger. Jacob is in health policy and management, where his research is focused on the economics of health insurance markets, with particular emphasis on the impact of managed care in public insurance programs. In other work, he studies how changes in health insurance coverage impact health and financial health. Finally, he's also interested in provider performance and efficiency measurements. Jacob was praised by his students for generosity with his time and attention to the individual student thesis process. One wrote, "He continuously found the time to patiently guide me through my thesis and treated the project with the same importance of one of his own projects." Mike is in biostatistics with co-appointment in the Department of Veterans Affairs Cooperative Studies Program. His areas of focus are in device data stream analysis, applied algorithmics, clinical trial design, and operation. Mike was praised by students for being extremely accessible to them through their processes. They wrote, "Mike often spends long nights concerned with his students, responding to emails at 3 or 4 a.m. He goes beyond teaching with his impact and even asks students no longer enrolled in his course about their concerns, feelings, and insights." Where are Jacob and Mike? There? And there. Good. Thanks. Congratulations on receiving the Distinguished Student Mentoring Award for the 2021 academic year. The Distinguished Teaching Award, also called the Teacher of the Year Award, is the student's highest honor for its teaching faculty, bestowed by its graduating students. Quality teaching is one of the most important influences on a student's experience at Yale, and this award recognizes the recipient's leading role in shaping the next generation of public health professionals. I'm not going to try to stop you from clapping twice on this one, so we'll clap twice. The 2021 recipient of the Distinguished Teaching Award is also an assistant professor, Dr. Yasmin Salinas, in chronic disease epidemiology. Where are you, Yasmin? There you are, over in the corner. You get to stand up twice. Yasmin earned her bachelor's degree with a distinction in molecular, cellular, and developmental biology from Yale College, and both her M.P.H. and Ph.D. in chronic disease epidemiology, the first from M.P.H. in 2014, and the second from the Yale Graduate School of Arts and Sciences in 2019. Yasmin's research is focused on the intergenerational transmission of obesity and its comorbidities, particularly through the lens of genetics. Her current work searches for genetic variants relevant for obesity-related metabolic disorders, examining the interactions between maternal genetic factors and early life modifiable risk factors for adverse metabolic outcomes in children. Yasmin teaches 2 upper-level courses, Principles of Epidemiology 2 and Advanced Applied Analytic Methods in Epidemiology and Public Health. Students lauded her for her passion for research, thoughtfully prepared course and instruction materials, and detailed yet succinct delivery of the material. Further, they said that Yasmin was a wonderful leader. She demonstrates incredible passion for teaching. Our graduating class, you all, selected Yasmin for this award in recognition of her deep concern for her students' well-being and putting her heart and soul into every lesson she plans. Congratulations, Yasmin, on receiving this well-deserved Distinguished Teaching Award honor. Now, this may be a little corny, but would the 4 of you stand up one last time as I acknowledge that all 4 of these outstanding teachers and mentors will have their names inscribed in the awards wall of the first floor teaching area at 60 College Street. Thank you so much. Next, we would like to briefly acknowledge our 4 faculty research awards, recognizing distinguished peer-reviewed manuscripts. We highlight the research awardees this Wednesday in our YSPH faculty meeting to highlight the public health impact of their impressive research. And I think all of them are joining us virtually today. The Early Career Investigator Research Award is given to an assistant professor or associate research scientist within 10 years of their appointment. And we actually had a tie for this award, too. So congratulations first to Dr. Abigail Friedman, very recently promoted to associate professor, for her paper entitled Smoking to Cope, Addictive Behavior as a Response to Mental Distress, published in the Journal of Health Economics, and to Assistant Professor Dr. Crystal Pollitt for her paper entitled The Fresh Air Wristband, a Wearable Air Pollutant Sampler, published in Environmental Science and Technology Letters. Acknowledge Abby and Crystal. Next is the Investigator Research Award, which is presented to a YSPH primary faculty member of any track or rank. Congratulations to Dan Weinberger on the paper, Estimation of Excess Deaths Associated with the COVID-19 Pandemic in the United States, March to May 2020, published in JAMA Internal Medicine. This was the most cited paper of 2020 in that esteemed journal. Dan? I'd now like to announce the school's Team Research Award. Congratulations to 3 people, Jacob Wallace, Chima Ndumele, and Anthony Lolo, for their paper entitled Comparison of Office-Based Physician Participation in Medicaid Managed Care and Health Insurance Exchange Plans in the same U.S. geographic markets. This was published in JAMA Network Open. Given the uniqueness of the 2021 year, we're giving a 4th award for COVID-19 related publication. This goes to Dr. Ann Wiley, an associate research scientist who published her work on saliva or nasopharyngeal swab specimens for detection of SARS-CoV-2. You've all heard about Saliva Direct in the New England Journal of Medicine. Congratulations, Ann. I also want to acknowledge all the co-authors, many of whom are from the school, but some of them are from all around the world. The co-authors for Abby, Crystal, Dan, Jacob, Chima, Anthony, Ann, for their contributions. We're now going to take time to honor all of you, our M.P.H. graduates. Please follow the direction of staff and be sure to bring your diploma folder with you to the stage for our masked photos.
Queenie Ann Abad. Sumera Akbarzada. Yumna Ali. Jennifer Bowers. Sausan Dabit. Jose G. Diaz de Leon. Seema Doshi. Daniel Faber. Levi Aaron Harris. Kubilai Kaimaz. Jan Lockeen. Alizia Mascolo. Rhett Meyer. Walid Siddiqui. Yu Song. Thomas J. Stovall. Alexa Strauss. Bruce Randolph Tizes. Jacob Paul Van Houten. Moises Vargas Mena. Christopher Williams. Joseph Zell. Hoi Ing Chen. Joanna Chen. Yushu Chung. Dan Yang Gong. Dan Yang Ko. Zai Sheng Huang. Yongfeng Hui. Hengqia Li. Ira Li. Jun Ten Liu. Ching Ma. Fuyang Peng. Yu Sheng. Ran Tu. Fan Yi Wang. Jia Pong Wang. Ji Ping Wang. Kangxing Wang. Yingfei Wu. Jingyao Xu. Xi Yang. Yijing Yang. Carlin Fair Alo. Julia Banas. Dady Suhei Garcia Torres. Connor Grady. Zipei Huang. Cameron Javadi. Jeanette Zhong. Roja Jing. Su Jung Kang. Uan Ling. Zape Liu. Damaris Lopez Mercado. Wenlan Mao. Jinji Meng. Nida Nashad. Emily Aaron Saudi. Laurel Sharpless. Siyu Shan. Sedenya Simi. Michelle Olua Dami Lola Sidipo. Madeline Tessier Kay. Yakin Wenren. Wayu Shi. Yi Wen. Sonia Evelyn Zoe. Junli Chu. Yihui Chen. Nicholas Donald Elton. Tristan Alexander Fernari. Felicia Hung. Ji Hao Jin. Bingqing Li. Cheyenne Liberty. Yuhong Lu. Edan Meng. Peter Romeliotis. Hubian Wang. Yin Chao Wang. Allison Elizabeth Bailey. Dwayne Barksdale II. Matthew Stephen Benchkowski. Madeline Olivia Bender. Holly Burrows. Lauren Marie Campbell. Tyler Renee Carruthers. Andrew James Chambers. Gina Marie Chimento. Nirvana Kimberly Dominguez Singh. Corianne Dorgay. William Eager. Eduardo Encina. Cole Jensen. Laura Casper. Jia Kwan. Esther Lowe. Brandy Moore. Mora Nakahata. Sonam Patel. Colin Thomas Rapson. Arekta Shivetson. Mungi Su. Lucas Walls. Anne Elizabeth Watkins. Catherine Willebrand. Frank Wu. Karen Jane Young. Misaker Wonderfala Ethnow. Han Chang. Pooja Doshi. Kayla Foley. Julia Kaufman Frederick. Golden Gao. Aneta Goshivska. Shruti Gopal. Zhongling Li. Alejandro Liavano. Emily Louise Lynn. Salam Malis. Garrett Miller. Andrew Willis Nguyen. Christian Ellis Olivier. Aidan Pillard. Sina Natalie Reinhardt. Christina Danielle Roccini. Shavani Shanavaz. Safia Simone Spear. Logan Stroberg. Lillian Wolfenson. Mukesh Adhikari. Dorothy Alexis. Donya Atia. Fong Ba. Evangeline Yining Kai. Christophe Bawa. Carmen Nicole Clarkin. Claudia DeBryan. Christina Anna Deutsch. Sylvia Lucia Diaz Roa. Saliha Ama Dick. Hui Yi Dion. Jocelyn M. Dorney. Jad El-Harki. Victoria Ellison. Sasha Gibble. Deanna Marie Giraldi. Laura Kim. Savannah Kuchera. Sunny Light. Rosette Nguyen. Chiffon Pan. Rebecca Schwarz. Mark Sepama. Zaria Camille Smith. Samantha Gabrielle Stone. Mahira Tavwana. Kaylin Archiga. Conlon Bass. Morgan Nadine Veronica Buchanan. Haley Case. Mariah Frank. Abigail Gnader. Eva Groff. Di Yi He. Alexis Hopkins. Rucha Condler. Marina Brewster Kateg. Lily Benson Kofke. Jessica Dong-eun Lee. Lakai Leg. Serena Lee. Aaron Matthews. Madeline Hoi Cho Nguyen. Zoe Novick. Christabel Ong. Ashley Rorig. Megan Marie Roy. Crystal Ruiz. Anna Elizabeth Schwartz. Victoria Tran. Stephanie Nicole Vasquez. Abigail Waugh. Shirley Zen.
Again, congratulations to the history-making M.P.H class of 2021. It's been a stressful time, and you have come through it with aplomb. Let me now take a moment to acknowledge our YS.Ph students who are receiving their Ph.D. and Master of Science degrees today from the Graduate School of Arts and Sciences in a separate ceremony. Many of them are joining us virtually. We have 10 Ph.D. graduates and 34 Master of Science graduates. We're most glad to include them in our virtual commencement ceremony today and wish to acknowledge their participation in the separate Graduate School of Arts and Sciences commencement events. So please join me in recognizing our 44 additional graduates. Okay, we are nearly there. Class of 2021, the degrees you have been awarded today are a testament to your perseverance and commitment to the field of public health. This is a wonderful accomplishment, especially in this challenging COVID-19 year. I want to thank all the families and friends of the graduates for joining us in this mixed virtual and live celebration that accommodates the exigencies of the COVID-19 pandemic. All of you in physical or virtual attendance, families, faculty, and staff alike, have encouraged and inspired our students to succeed in this exciting stage of their career studies. Yale University also wants to acknowledge that Indigenous peoples and nations that have stewarded through the generations the lands and waterways of what is now the state of Connecticut. We honor and respect the enduring relationship that exists between these peoples and First Nations with this land. In Greek mythology, Cassandra was punished for angering Apollo by being able to see into the future, but for no one to be able to hear her prophecies. For decades, the public health community has been warning the world of a pandemic respiratory viral infection, of the need for exercise and healthy foods, of the need to protect the environment from toxins and wastes, of the need to eliminate disparities in access to health care, of the urgency to improve the efficiency and effectiveness of our health system, and perhaps most urgent of all, to combat global warming, population pressures on the natural environment, and the consequent loss of species diversity and natural food chains. We can no longer go unheard like Cassandra. YS.Ph commits to improving our communications to the public and to our policymakers. We commit to partnering with you, now our alumni, and your friends and families as enlightened leaders in this struggle to prevent disease and promote wellness. Public health must take an even more prominent and vocal role in contributing to the welfare of humanity. Students and faculty alike have been called to train and work in public health. Most of you are joining our burgeoning public health academic and leadership communities, while others of you will bring your new prevention perspectives with you into other fields like medicine, nursing, law, or business. Regardless of your exact career trajectory, you will leverage your Yale public health experience to educate others. We do regret that the pandemic circumstances did not permit all our 2020 graduates and some from 2021 to graduate in person here in New Haven, and that family and friends of all students could not celebrate here in person. There's nothing more that we enjoy at this time of year than to share the graduation ceremonies with freshly minted alumni and their loved ones. Thank you most sincerely to our student affairs team that has worked hard to produce this hybrid live and virtual event. Dr. Frank Grosso, Associate Dean of Student Affairs and Public Relations, Registrar Stacy Tuttle, and their many colleagues in Student Affairs and the Dean's Office, and our IT gurus from Fogarty Services in St. Louis for this tour de force. Would all the staff who've helped put this all together, would you just stand for a moment of recognition? Please stay in touch with us and the Association for Yale Alumni in Public Health, known as M.P.H, in which you are now subscribed. Let us know about your work and successes. We hope you will volunteer to advise our incoming students this fall as mentors and to receive future summer interns for experiential learning in your own future work environments. We will also value your advice and your support. Stay safe with the help of COVID-19 vaccines, and do not hesitate to reach out to all of us at YSPH in the years to come. This concludes our YSPH diploma ceremony. We ask that all students remain in their seats and await staff direction. Thank you very much.